Hi guys, welcome back to my YouTube channel, and if you're new here, welcome. I'm Dr. Rosie, your friendly family physician, and today I'll be speaking to you about the condition of laryngomalacia. It is definitely a medical topic. I'll be going briefly over the condition itself. I'm not a medical expert and nothing here should be used as diagnosis. For diagnosis purposes. However, for educational purposes, I think the more we know, the more we are empowered. And being a physician, mother myself, I find it very useful to have some information on this topic that I needed to extra research myself. Other than that, I'll be also going a bit on the backstory on what happened for us, how was it diagnosed, where are we at, what are things that may have helped us for our baby with laryngomalacia. If you enjoy my channel and these topics of medicine, topics of personal and growth and development, please do subscribe to my channel and like this video. Let's get into it. So laryngomalacia is basically laryngo, which is the larynx, malacia, softening. So softening of the larynx, the cartilage tissue, which is basically underdeveloped in a baby. It's a congenital condition, the most common cause of stridor in neonates, in babies who are born, meaning they're born with it. There are no precursor or epidemiological factors that make them more at risk. For example, I had a completely healthy normal pregnancy and my baby ended up having this diagnosis. That being said, it could still be extremely worrisome and scary when you do notice it and diagnose it for the first time in your newborn. Now, softening of the larynx, what does that mean? It means that when the air comes in or out, it could be a collapse prematurely of the larynx, which is the tissue right above the vocal cords. And what it will present with as a symptom is stridor. Most commonly, the number one symptom is that, which is basically wheezing when you breathe in. So most people know wheezing as a symptom of asthma, correct? That kind of noisy, squeaky, squealy breathing, which is closing of the airways, but more the bronchioles. Whereas here it's an upper respiratory condition. And so when they breathe inwards, it sounds more like that. Not diagnostic, but it sounds pas mal like that. So that's what the condition actually is in its physiological or anatomical description. How is it diagnosed? So it is something that is either classified as mild, moderate, or severe, depending on symptoms. And it could be diagnosed clinically if your provider is expert enough to be able to make that diagnosis. Otherwise, an ENT, ear, nose, throat specialist, will go in with a camera, laryngoscopy, going through the nose and going into that voice box to look at the anatomy during a baby's screaming, which is to see whether it's flappy and prematurely closing or not. Now, mild, moderate, severe depends on the symptoms. I don't know the exact criteria, but basically severe would be a baby who has apnea episodes of not breathing, cyanosis, where they turn blue, or failure to thrive, which is the inability to actually gain weight properly. These are generally the guidelines needed in order to decide on surgery or not. So it could be surgically repaired. In our case, luckily for now, it's not. It's considered moderate. So most of the symptoms actually have to do with feedings, nighttime breathing, especially in supine, meaning on their back position. That's majorly the symptoms. And then mild, I don't know, I guess it would just be noisy breathing. That being said, there are some conditions associated with it. Most commonly would be regurgitation. So they're often treated concomitantly, meaning the treatment for laryngomalacia, if it's non-surgical, is kind of a watch and wait approach, because children will generally grow out of it by the age of 1. As they grow stronger and develop, the condition will treat itself or heal on its own. However, the symptoms throughout that first year or 2 years, however long it lasts, are what are managed. So if you can control the regurgitation, that will often help some of the symptoms or correct some of the symptoms of laryngomalacia, because it's causing additional swelling with the reflux in the larynx. That is the case for us. So now, as for us, now you know what laryngomalacia is. How, as a doctor mom, did I figure out that that's what my kid had? Fortunately or unfortunately, I guess fortunately, I picked up on it pretty soon. So the natural course of this condition is first or second week of birth, baby is typically normal, and then 2 or 3 weeks in, the noisy, weird breathing or stridor becomes evident, and that's when people tend to consult. So I would say week 2 or 3, baby was sleeping next to us naturally in our bedroom, and the noisy breathing of a newborn was going on. However, it sounded a little weirder, like laborious, I would say, and scarier. And my husband literally went to me and he said, "What is that, Rosie? Like, why does it sound like that?" And I thought in the middle of the night, and I literally go, "Stridor? It sounds like stridor." I've obviously heard it in clinic. And then I went and I'm like, what could cause stridor? Because obviously, you know, mom brain, doctor brain, they're not on at the same time, at least not for me. When I'm with my kids, I'm a mom. When I'm at work, I'm a physician. And that's kind of how my brain works. Sometimes you need to bring them together. You also don't want to be the one diagnosing and treating your own kids. So there's a fine line to discern between those two roles. However, in that moment, I was speaking out loud and thinking out loud and verbalizing, and it just, all the puzzles clicked together. And I'm like, Laryngomalacia, what causes stridor in a newborn? Laryngomalacia, like most commonly, right? Otherwise, it's like foreign bodies and other infections. In any case, the most common I know is that. I said, well, I guess it must be that. Let's see his pediatrician and ask. The following week, we had an appointment. She confirmed it likely is that. I'll refer you to ENT. ENT, I had a following appointment a couple weeks later. However, the sound was getting worse. The breathing was getting noisier. He seemed to be more in distress. And there are also signs of distress you could see in baby's breathing, but I won't get into that. And the feeds were particularly difficult. So I'm breastfeeding. We tried bottle feeding as well. And either or, there were episodes of choking and coughing and spitting up. And it wasn't simply regurgitation, because I know what that looks like. So I pushed to have the ENT appointment sooner. I got it sooner. One night it was just really bad, and I said, I'm going to the emergency. Went into the emergency, ended up seeing ENT the same day, got the scope and confirmed that it was moderate. Everyone's case is different. Everyone's journey is different. This was just the beginning, the tip of the iceberg, because it was everything after that. That's him grunting and moving, but he's cute. Everything after that kind of is what we deal with, is what we need to manage, what we want information on, because you're living with it day to day. Your doctor doesn't see you daily. Your doctor doesn't kind of manage the ins and outs of the symptomatology. They either say surgery, not surgery. Are they growing? Are they not growing? Fair. That's what medical experts do. I know that on being that side of things, but I also know on the mother side of things, it's so hard on a day-to-day basis. I don't know if you heard that, but yeah, that was pretty much stridor. But how to manage with the day-to-day is what's been hard. All right, so he's insisting on joining us for this video. That's what it is with a newborn. Even my last video, he had to join. It's cool. What are we doing? Again, the laryngoscopy kind of confirmed it. There was also some edema on the larynx area, so they confirmed that there is silent regurgitation. So for that reason, we got medicine. There are two types of anti-reflux medication, generally speaking, that are given to newborns, given with a syringe. I give it once a day. There's some that are given twice a day. So that's part of the treatment plan. Otherwise, feedings overall have gotten better. Initially, like I said, there was a lot of choking, and that was both, we tried bottles, different nipple sizes. I thought maybe it was an issue of overflow, so I also pumped before feeding. In any case, I have to say it has gotten better. Everyone's journey is different. Some people I've read on blogs, I've read in groups, I've spoken to other mothers with children with this condition that it took several weeks, several months, varying conditions. Some babies needed other treatments for the feeds, so to thicken their feeds. There are many different things. In our case, luckily, anyway, I don't want to jinx myself, but it's been a good week where there hasn't been a choking episode during the feed. Yay. The reflux helps as well. So some things are self-resolving. The other big issue that has been basically ours is nighttime. So baby sleeping, I'm all for sleep training. I did it with my first and it worked well, and he's an excellent sleeper. And by this time he was sleeping for 6 to 7 hour stretches. Not the case with this guy, mostly because of our high alertness about his breathing. So any kind of sound or discomfort or distress, we kind of jump to him. Fair enough. And B, because he's uncomfortable. He's a lot more restless when he sleeps, and especially when he sleeps, you think he's funny? When he sleeps on his back, which is typical. So something we've done to help with that is a wedge. We bought it on, I don't know, a baby store. A wedge that goes into the crib, also one that goes into the bassinet. They're different ones. He's just smiling at me. And it's been quite helpful. We also hold him up after a feed for about 10 to 20 minutes now. It was like 20 to 30 minutes a couple weeks ago. He's only like 10 weeks old. So I'm literally speaking in weeks. Sometimes it's days apart, but I'm talking about you. But the wedge has helped with the nights. They tend to like to be on their side also, but I can't even manage to do that. He's so small. And lastly, a pacifier. I was not anti-pacifier with my first one, but he didn't care for it so much, so I didn't even push for it. And he kind of learned to self-soothe with his fingers. He's starting to suck his fingers, cool, but the soother really does help with reflux at night when he's uncomfortable. And I don't know, there could be a million other reasons, but in my head it's always like laryngomalacia. His breathing is difficult. So that's where we're at. If you guys have questions that I could try to answer, please write in the comments below. I hope this was helpful to some of you. I will try to keep a little update on YouTube on where things go in the coming months, because this is a month-to-month thing. He has now a visit every month with his specialist and his pediatrician, regular visits, follow-up visits. The most recent one basically just confirmed that his weight is good, and the thing I asked for was a night study. So it's a pulse oximetry, which will examine his saturation levels throughout the night in order to more confirm or not that his oxygen levels are normal. Sometimes there are other conditions that babies have that cause the problematic sleeping, the stress sleeping, but in his case, it's pretty obvious that it's laryngomalacia. I just want to make sure that he's not desaturating during his sleep. That is the next step. It's something you can also speak to your specialist about if ever you're curious or worried and a baby with laryngomalacia. That's about it. Obviously, stepping backwards as a physician, we did learn about this topic, but it's kind of something that you skim over as a medical student. If you don't see it in practice, then you don't know much about it. But living with it gives you much more perspective and the ability to counsel and care for patients who may potentially have it down the line. I'm sorry if this is really noisy. Hard to be filming and soothing him, but you guys get the point. I hope this helped, and I wish you all a wonderful day or night. Take care.